Hi guys, welcome back. It's Drsaru. I hope you're doing well. Welcome back to my channel. If you've not subscribed yet, sorry, please hit that subscribe button and like this video and comment. Tell us your experience, if you've ever had an experience with whatever I'm about to speak on, and please join the family. Karibu sana. So, what is morning sickness? Morning sickness is the usual kawaida thing people get when they're pregnant, or not most of people, but some people do get it. You get nausea here and there, and you get you happen to vomit sometimes, like once or twice in a day, especially after you've eaten. But have you ever heard of something called Hyperemesis gravidarum? I thought you should today. Hyperemesis gravidarum is an extreme form of morning sickness because it is worse off than morning sickness. You have almost 3 to 4 or even more episodes of vomiting. It is associated with a very terrible nausea and sometimes with dehydration or even severe dehydration. It normally occurs before 9th week of pregnancy or around that time when somebody is still in the first trimester, and it tends to ease out as the pregnancy advances age. It is mainly caused by increase in hormone, especially the hormone estrogen and beta HCG. So at that particular stage of your pregnancy, it's normally in plenty in circulation, and that is what causes the whole hyperemesis gravidarum. So for morning sickness versus hyperemesis gravidarum, the only person who can actually make the correct diagnosis about this is your physician or your obstetrician, because in most cases you can it's actually a diagnosis of exclusion, because you might not really know from home if you're having hyperemesis gravidarum or it's due to an infection, or maybe you just had malaria, that's why you're vomiting that much, or you have other sort of infections or other things going on that is making you vomit that much. So it's always nice to come to the hospital. We run a couple of tests so that we can be able to tell you, yes, this is hyperemesis gravidarum and this is how you're going to manage it. And in most cases, it needs hospital management because, as I mentioned earlier, it has some very severe symptoms, including having to be hospitalized because of dehydration. So it's always good to come to the hospital so that we can be able to assist from there. So how will you know that you have hyperemesis gravidarum? What are the signs and symptoms that you can actually present with? So feeling of constant nausea, like the whole day you're just nauseated, you feel like, oh, I need to just throw up. Okay, the other one, loss of appetite. The third one, which I've already mentioned, almost over 3 to 4 or even more times vomiting, becoming dehydrated, feeling dizzy or lightheaded, and in some extreme cases, people lose about 2.5 to even 5 kilos during that period that they're having that issue. So now that you have known what are the causes, what it is, the risk, not the risk factors, sorry, that is what I'm coming up with next. The signs and symptoms, let's dive into the risk factors. So who is at risk of developing this thing? With a family history of people who've had in your family, maybe your mom, your auntie had the same problem. So one is family history. 2, if you're an obese mother or an overweight pregnant woman, you are at risk of developing hyperemesis gravidarum. The third thing is multiple gestation. So if you're having twins, or maybe you're having more than 2 or whatever, triplets, depending. But if it's a twin or a multiple gestation pregnancy, the level of the hormones are high, so chances are higher that you're going to have hyperemesis gravidarum. The other thing, if you're a first-time mom, it's also a risk factor, but not always or usually, but there's a risk of you developing the same because you're a first-time mom. So the other thing that I wanted to mention is trophoblastic disease. You can also get the same, especially with trophoblastic disease. They tend to have those severe forms of morning sickness or the hyperemesis. So now let's get to the point where we diagnose this. As I told you, it's a diagnosis of exclusion, but you'll have to come to the hospital first so that we run a couple of tests. And of course, if it's trophoblastic disease, it's different management altogether, meaning we don't even have a pregnancy there, and your doctor will encourage you or will tell you how we're going to deal with that, with the management of the same. So now that we've known you actually have hyperemesis gravidarum, how do we treat it then? Again, it depends with your severity. If it is so severe, then definitely your doctor will have to get you hospitalized so that you can get everything IV, including your medication, the fluids. Sometimes for those who get really worse, even for feeding, might need parental feeding. But for the people who it's just there, it's like moderate or mild hyperemesis, you can take home medicine and also be encouraged to take plenty of fluids. Like I told you, because of the fact that you're vomiting a lot, dehydration is what we are worried about the most. So definitely take plenty of fluids, hydrate, and then antiemetics. There's a role of antihistamine also, which has been shown to help with hyperemesis. And then for things that you can do from home is take small frequent meals. So maybe 2 spoons sahizi, 1 spoon later, like that. So like you have something staying in your stomach, but not too much that is a bulk that you can maybe vomit it out. Some things that you can avoid to help you with hyperemesis gravidarum is 1, avoid spicy foods, avoid salty foods, avoid fatty foods. They tend to make the situation worse. And then the other thing that you can also do from home, you can put a small piece of ginger under your tongue so it can slowly be absorbed. It also helps with vomiting. Or you can just boil some water, grate your ginger, and drink your tea. Also, that will help. The ginger tea will help with the vomiting part. And of course, if you're drinking it as ginger tea, you're also getting to have water in your system. So even the dehydration aspect of it will be taken care of. So yeah, I hope you had fun and you learned something new from today's lesson. Until next time, it's Dr. Saru. Love and love.